face exam and a skin assessment and cleansing today. Perfect. Hello there. Yes, this is one of the exam rooms. You're here for an appointment. Perfect timing. Please come on in and take a seat at the dermatological exam chair in front of me. Thank you. And might I say, your skin is looking very good today. Yes. Now, dear, it's a pleasure to meet you. I am Dr. Luna. I specialize in dermatology and neurological function. Yes, it's a pleasure to meet you. Truly. So, what brings you in here today? Okay. Okay. May I touch your face? Thank you. So, what you're saying is you've had a couple of troubles with your eyes. Yes, I can see. I do see a bit of redness and swelling around the eyes. Let me quickly add some cream to that. A bit of a antibiotic ointment should do the trick. Just going to very carefully get a bit of that. Just going to apply it to the under eye area. Okay, this should be a bit soothing. Good, just a bit. Okay. Okay, could you close your eye really quick? Thank you. Okay, the other eye now. Just look at me. So, just going to very quickly apply just a bit of that under the eye. And close your eye for me. Thank you. Just a bit like that. Good. That should feel better in just a bit. Just let it sit, okay? Good. And before we continue, could I grab your name? Okay. Thank you. And could I get your birthday? Beautiful. And do you have your patient ID number anywhere? We typically give it out on a wristband. Yeah, just read the numbers out for me. Okay. 6, 7, 8, 999 8212. Perfect. You're all signed in now. Very carefully. I'm going to touch your face again, but I'm doing a muscular assessment and reflex test towards your eyes, eyebrows, and mouth. Good. So just excuse the close up. going to get my gloves on now. And based off of your concerns of your eyes, I'm going to do a thorough face examination, okay? Good. So, just going to begin by doing muscular distribution and feeling your face to see if the muscles are working properly, okay? If anything feels uncomfortable, let me know. Good. So we're going to start off first by just... Okay. Good. Okay. Okay. Good. Good. Okay. Good. Good. Okay. Good. Other side now. Okay. Good. Okay. Good. Okay. Good. 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 Now I'm going to put pressure around the temples of your face. You let me know if you feel it, and you let me know if it feels a bit uncomfortable. Okay, good. So very carefully, I'm just going to put a bit of pressure onto the sides of your face now. And did that feel uncomfortable at all? No. Good. Now I'm going to use my pen light here. I'm going to get a little bit up close. Is that okay? Good. I'm just going to scan through and look at your face, particularly all of the areas that are of most concern: eyes, nose, mouth, and maybe your ears as well. Yeah. So, pen light. Just relax. Just going to take a very up-close look at your face here. Just making sure that just say I'm seeing that there must be muscular distribution going on. That would be proper for this kind of look now. Just when I'm taking a look, just to see if that's what's going on, just to make sure that that's okay. So, muscular ability. Could you lift your eyebrows for me? Thank you. Just going to take a very quick look. You can see it. Just take a very quick look. When I do see that's going to take a little bit of a look, I'm just going to make sure that is following along with what taking a look with the other side. Okay. Now please, very carefully, just look at me. I'm going to look around your eyes, okay? Perfect. So, just okay. could you smile for me a bit? I know it's a bit awkward to ask you that, but I'm going to put some pressure on your cheeks to see if the muscles are working. If not, I'm going to apply solution. Okay, thank you. Okay. I'm going to quickly write this down. So, next to the eyes, there appears to be muscle distribution. Neurological problems could be the result of this. Have you recently fallen, not had good sleep, or perhaps something, perhaps an illness? Have you been sick in the past 4 weeks? Okay. So, relative towards health, understood, not an unknown cause anymore. Thank you. We're going to apply a couple serums to the face and do a very thorough cleansing and a very detailed face look and massage to help the muscles. Perfect. So, just going to take a look around here too. Take a quick look. See what that could be. Okay. Try not to sneeze. I'm going to just touch her on the nose. So, just going to see here. Okay. Okay, I do see some general ones. Okay. Now around the jaw. Just to make sure that. Just going to take a quick look there and going to see if that is what could be going wrong. Just going to look. Okay. Perfect. Thank you. Gonna turn my light off now. Skin texture perfect for age. Muscular distribution was a bit off around the cheeks and the eyes due to irritation. Okay. I'm gonna do something called a sinus pressure test. And I'm just going to tap on the areas where your sinuses are. You let me know if you feel it and if it feels uncomfortable. Good. Just reply by saying, okay. Great. So, here we go. Just going to tap very quickly. Any uncomfortability? No. Double vision? No. Good. Any uncomfortability? No. Double vision? Okay, no, good. Just going to very carefully just put some pressure along these areas too. Okay. Wonderful. Now around the sinuses here. Okay. So just going to very carefully just any uncomfortability? No, good. Okay. I felt a bit of swelling on the side, but that is definitely relative towards the eyes. So, swelling relative towards the eyes. Okay. On to the other side. pain? A bit of sensitivity, okay. Same on that side, so swelling on that side of the face. Okay. Thanks for letting me know. I'm now going to continue the assessment of the face with a very quick look at your eyes again. Your eyes appear to be just a bit irritated. They do look better after the medicine though, so that's always a good note to note. Okay, so what I'm gonna do first is add in some eye drops, okay? Just if you could please just look up for me. Thank you. Okay, and blink. Once more. Just adding them into the eyes. 5. And blink. Thank you. The other eye now. So just very carefully going to add that. Okay. And blink. Good. And adding that back onto your eyes. 1, 2, 3, 4, 5. And blink. Very good. So, for the next part of this face exam, I'm going to do a very quick neurological pinching and reflexology test. Okay? Especially because your eyes are so vulnerable right now. I just want to see if the assessment of your facial muscular features are working properly. Good. I have these very soft tweezers, and I have these not so soft tweezers. I'm just going to very carefully pinch at different parts of your face, and you let me know if it's soft or a bit rough. Thank you. So, let's begin. Close your eyes. Good. Here we go. Okay. 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 Perfect. Okay. Perfect. Okay. 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 Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Very good. Very good. Next, actually wear a mask to apply this medicine. Very carefully. Okay, and I'm just going to carefully apply medicine onto the areas where the muscular distribution was a bit off, okay? Good. First, we're going to start with a very strong acid peel. It's going to help the skin's elasticity and also help the muscular distribution. So, just going to take a bit onto the back and very carefully. I'm just going to apply that to the skin. Okay. And how are your eyes feeling? Good. Just going to very carefully. Very good. Thank you. And last but not least, a bit of a refining oil for the skin. So, I'm going to use some hyaluronic acid. Good. Applying a bit to the hand. Just going to very carefully just pat that. Onto the skin. Okay. And how does your skin feel? A bit better. Good. I also see that just by generally looking at the health of your face, that your muscles appear to be a bit more as they should be as the medicine that was applied starts to work into the skin. Yes. Do you feel a difference at all? Good. That's perfect. So, now that the results have been very good, I'm going to send you home with a prescription. Yes. So that you can continue to apply with this treatment and you can feel better soon, okay? Great. Have an amazing rest of your day. I'll write you a prescription. If your eyes or the muscles underneath your eyes start to react, or perhaps the irritation under your eyes starts to grow, please come back for another appointment and another visit so that we can better assess your health and take care of you, okay? Just relax now. Have an amazing rest of your day. And let me go write some prescriptions.